Thank you,
Thank
thank you,
you.
Anton.
Yeah.
Anton, I want to thank you for sharing those slides and for sharing your journey, because it's extremely interesting the way you started, what you've been doing, and where you're going. And that's the title of the webinar today. It's not just the present is where we're going as well, the future. I have always, and I not an idea, but my belief is, and I shared this with you before, and that's why I wanted to bring it here today. My belief is CT, X-ray, MR will all merge one day. We're not going to have different modalities. It's going to be one scanner, patient comes in, comes out, no interaction from us, and the report comes out of raw data. So I see that happening. I see that happening. And let me start by saying that people are already scared with remote scanning. Let's avoid this conversation because if you go the extra step is even worse. But this is something that I envision as well. The doing CT, X-ray, MR. We're already going into MR sequences that are assembling or resembling CT scans. So the idea is exactly that we reduce the amount of modalities that we have. We just put a patient in very quickly. They don't even need to be positioned. They just go in and AI does everything. So in terms of remote, let's start there. How was it for you to start from being an app specialist and working with 7 Tesla scanners and training people around the world and eventually finding yourself in your home at the sofa scanning the first patient? What did you feel then? And did you see where you are today on that day or not really?
Yeah, first of all, I would start with my director. He's Professor Forsting. He's a visionary person. He's a mentor and a friend of ours. He's an advocate for radiographers, supporting all the radiographers in Germany. He's well known. One day in 2016, he came to me and said, "Come on, we should have to go to Sao Paulo, to Brazil." So I said, "Why that?" I was working 15 years in MRI, really, really. I loved MRI as you do too. And I was working, as you know, we have all kind of scanners from 1.5 to 7 Tesla PET MRI, and doing all the things, developing coils, developing sequences, and developing automation techniques. So, and then I thought I have shown everything. I was trained by a huge company, German company, as an application specialist. So I was always up to date. So I thought, what could happen? And he said, no, I heard something, we should have to go to Brazil. So I said, wow, nice caipirinha. And 2016, it was Olympics in Rio. So
Yes.
and I said, all right, I am ready. So unfortunately, we didn't go to Rio, but we went to Sao Paulo I would say to an office. And I said, what's that? And I went into this office and I saw 30 radiographers sitting in one room in front of screens, 2 screens. And I was really, really, really shocked. First shocked, and I said, it was unbelievable for me as a normal radiographer. And we saw that these people were performing 2 scans at the same times, mostly standard examinations without contrast, mostly knees, spines, and things like that. And it was like, in New York, it was like a bank with somebody dealing with money. So it was like a bank.
Something like this.
Definitely this one, yeah, this
Right.
one.
Can
So
imagine
I
something
was
like
I was in this room. I think I was in this room. So it was for me like, come on, what's going on? So they had maps, yes, they had maps, and they had numbers as we do too. In which part of Sao Paulo, which scanner is connected, how many examinations are running, and really, really, very, very, very well organized. And I was also able to see the other part on site. There were nurses working on the other side. So we went also to the other side to see who is working at the scanner. That's the first question I said. Who is working at the scanner? How can safety be given if you are working like that? But as I was there, my first thought was, wow, we should have to use it in Germany, because it was not a cool thing, but it was necessary for Germany because we were facing a very, very lack of radiographers. So, and the second thought was, all right, if they are able to perform remotely, I would one day lie on my bed, open my laptop, and I will perform the MRI examination. This was my first thought too. So what we've done is we went back to Germany. We asked for a collaboration with a huge German company and said, all right, we need this. We want to develop a very secure solution with a software which can be FDA approved. And then we were working on this. First of all, we tried everything, it didn't work very well. There was a huge delay. And to be honest, 5 of our best radiographers left our department and said, we don't want to work like that. It's really,
Anton,
it's really true.
when you
We
say
lost.
delay, just so people understand, is lagging, right? So you're moving the mouse and it takes a long
Yeah,
time
that's
to
a long time. It was like, it was they couldn't work like that. So they said, but this is not a technology, this is a mesh. So they left us and were developing. And as we were developing, and we tried really also 4 to 5 scanners during the development. Some radiographers who were able, very experienced, they tried first, and we had also some people from the workforce security department who monitored while we were working with this and seeing and measuring our stress, for example, to measure how we work performing multiple scans at the same time. During this day, this was 2016, we already tried during the years phantom scans from home first, then
That's what I was going to ask you.
yeah,
What were you scanning? So phantoms,
yeah,
probably fruits and
first
animals.
and volunteers. So then and we wanted to test the feasibility of the technical. We wanted to set the GDPR regulations. We wanted to first of all to test the workforce security to show that it's first feasible. So I showed to my manager and I said, here, this is feasible. And due to the regulations in our institution, um, the workforce council, the workers council, and the HR department said, no, you cannot work from home. So we tried it. It was evaluated. It was tested. It was validated, but it was still under hold. And as 2019, the pandemic came, it was a great opportunity.
Just the opportunity you needed, basically.
That's right. And because we had everything already tested, validated, and we were prepared in terms of protection of infection from our staff, we divided our group into 2 groups, staff groups, and then sent one group to home for 2 weeks, and the other group was on site. And then we changed the other group at home and brought the other one to. And first, all of these hurdles were checked at home from authorities, from the HR department, GDPR, data protection officer, IT security officer. They came to our home, checked first of all everything, and then first we were able to perform the scans from home. It was not easy, but the pandemic has transformed it. But as we have done the first scan, it was not just, it felt really, for me as a radiographer, was performing for many years MRI. It felt like, for me, like, really, I would compare that with landing on Mars or on the moon as the first person. So I called my chief and said, it works, it really works, it really works. So, and with that, it is not only the first MRI scan done from home, it is a new era for radiographers. It is a fundamental change. It opens up so much flexibility for radiographers. That's why we are really, really lucky and very, very happy that our vision has become true.
Yeah, that's amazing. So I knew about Brazil being some of the pioneers because some of the technology actually comes from Brazil.
Yeah,
They have a
definitely.
lot of great technology there. I just saw Stefan just putting it really works, an astronaut with the German flag. I believe that was the feeling that you had back then, because you were indeed paving the way for a lot of us and for a lot of companies to do something that we're doing today. So I understand this might have been a big shift for you, but you always been that kind of person that is driven to do something new, very connected to the future trends. And you were lucky as well to be in a university hospital that has that connection. We can say the connection with Siemens, and you would be able to trial a lot of things there, like new protocols, new workflows, all of these things. So you kind of pioneer a lot of these things for all of us
Definitely.
that
Yeah,
we're
yeah.
doing it today. I like the fact that you mentioned that your first thing was there's a lot of flexibility for radiographers now. Because most of the talks that we have around remote scanning, they're all about shortages of staff. And I think the biggest advantage of remote scanning is the flexibility, is the fact that you can work from anywhere, you can work in different pattern shifts and all of that. I want to tease you a little bit because I saw your presentation and you had a picture on the beach. And I saw that post as well on LinkedIn. I didn't comment about this, but I saw someone commenting on this post saying that, and she does remote scanning on a day-to-day basis, and we probably know each other. She was saying that probably is going to be a little bit misleading when we posting these pictures. What is your feeling about it? And I just want to say that scanning from the beach is it sounds amazing, right? But when you have the glare on the computer and all of that, I know what you're trying to say is it's possible to scan from anywhere. But how do you take that?
If I can just jump on some, this is the dream that I've been heard seeing people are approaching remote scanning. The first thing they told me is like, I imagine myself lying, just on a beach with my mojito, doing my scan. I was like, no, just go on annual leave.
Exactly, exactly.
Yeah, as you know, Sam, I'm a computer scientist too. And I'm wondering that really, really very young colleagues from me, yeah, programmers,
Mm.
they're working from Ibiza, Mallorca, from the beach. They're sitting the whole day in cafes, they're
Yeah,
my
I
friends.
understand that. I understand
Yeah,
that.
so the working place is if you are able to work from another place and you have the opportunity, we can use it. First of all, I was trained to think big always. That means for us means we have no every idea which we have in our hospital is a good idea first. So it's not like first of all thinking about boundaries, limitations. Is first of all to think about how can we reach this goal. That means if you want to scan from the beach, if a data protection is a problem, is the only one problem for me, the data protection. Yeah, that means you have to create a workaround where data protection is given if you are working from scan. From my perspective, work from a room with a beach view. Why not? Not sitting on the sand, for example.
And
Yeah,
just so everyone understands why your concern is data protection, is because basically if you're working in an area like
yeah,
that, you're working
yeah,
with public Wi-Fi. So that's the main risk. That's why Anton is referring to that. Sorry to interrupt you.
yeah, yeah. Thank you very much.
Yeah.
As a healthcare profession, especially radiographer, you have different things. First of all, always put the patient on the focus. Yeah, you have to deliver always the highest, best image quality as a radiographer. So first of all, the patient in the middle and the patient focus. That means you have to ensure that patient safety is given. Patient is also saved from the data, from his data, from her data. So if you are aware about the patient data, you should have to be very careful of using it. Yeah, that's why you should have to do workarounds to protect this. This is very, very important. So there are technical possibilities, for example, to work with the laptop and, for example, not to show the information what you have on your screen for others. there are different possibilities, but I don't want to to open a big discussion with working on the big. That's just only a marketing slide, you know.
Yeah,
It's
that's what I was saying. I think
yeah,
it's selling the idea that we can
that's
do
right.
it from anywhere, which is true.
That's right.
Which
That's
is
right.
true.
That's
I
right.
also actually shared on the remote scanning group that I created on LinkedIn, some colleagues that they scan on the plane. They tried on the plane with the
Saw
plane
that,
Wi-Fi
yeah.
they paid, and they managed to do it without any
If it
problems.
works, yeah, yeah,
So it
it
worked.
worked.
It
And did
worked.
it work? Did it work
Yes.
efficiently? Yeah.
Yes.
Because when I saw that picture, I was like, what like if connectivity or anything like that network suddenly like, get affected by anything within the
I'm
plane?
sure they were not scanning real patients, probably volunteers, but they tried it on the plane and it definitely worked. So
Yeah.
it comes to show that it's possible to do it from anywhere. And then when I scanned to Brazil, to Brazil, I was actually on my balcony, so it was kind of the same situation. But
Yeah,
of
yeah.
course, it's not the beach. But I just wanted to tease you there a little bit because I saw
No.
there were a little bit of discussion on LinkedIn, and I found it funny. But yeah, can I ask you as well, what do you think are the biggest, because you said something that is extremely important to me and probably to Julian as well as entrepreneurs and people that like to create stuff, which is the fact that you always see things as a challenge for good and you never see all the problems that are attached to it. So you see something, okay, how can this be amazing and how can we work with this and make this work for everyone else instead of, oh, but there's this problem and that problem and that problem. So you are very
Definitely, yeah.
driven. So you are very driven and you like things to work. So I know you also involved in setting up kind of the German guidelines for remote scanning. Can you tell us a little bit about this? Because it's a big topic around every single webinar that we have is guidelines and legislation. Can we scan from one country to the other? How can I scan in that country? Why can't I do it in my country? So guidelines are a very important thing, and I'm sure your involvement will be extremely beneficial for the German radiology world. So can you tell us a little bit about what is the work that you guys are doing, or is still a secret?
Yeah. First of all, as you can see, I'm not a German. Yeah, I was not born in Germany. I came as a refugee to Germany, starting as a dishwasher, and randomly fell into a radiographer's profession because at that time it doesn't matter for me any kind of job. I only wanted to have a job. All right, that for my history. Anyhow. Germany, yeah, Germany means quality, from the cars, Mercedes, Porsche, BMW. Should I have to explain anything else? That means we want to make the remote scanning as a kind of made in Germany quality. That means for us in Germany, there are 3 points which is very important. First of all, best practice, patient safety, and quality assurance. So these 3 points are wichtig, important. That was German, sorry. And also we want to create such a recommendation. For example, first of all, we want to define staff models like a minimum person on a site, maximum possible scans at the same time on the one hand. And then we want to open it up also for CT because in Germany it's not allowed to perform CT scans remotely. That's the whole point of view where we are working on.
Awesome. I think we're all waiting for that kind of document to come out, not
Yeah.
only from Germany, but from US, from other countries that are running remote operations. It's something that we really need. It's clarity. It's like guidance. At least have something to have our legs on, and okay, we can walk this path. At least we'll know it is possible. When you train, or I don't know if Julian, if you want to ask anything.
Yeah, actually, I might have a
Go
curiosity.
ahead, because I have so many questions.
Yeah, sorry. I know you might have many. I just have one for the
Go
moment.
ahead, go ahead.
So, I have a curiosity actually, because I think you mentioned, Anton, did you mention you worked with 7 Tesla before, right?
Right.
Um, so I was thinking, okay, how do you see the idea? You mentioned about guidelines, that are some work in progress. So this is again a step into the future already, but we are moving towards this high fuel strength. Sometimes we see news about 11.4 Tesla. So how do you imagine like remote scanning fitting these trends? Meaning that on a way we could be exposed to more safety risks and stuff like that. So how do you perceive you being one of the pioneer of remote scanning and see that, there are these things happening in the background? Do you think remote scanning will adjust accordingly?
Yeah, first of all, I would say innovation doesn't always mean improvement. Yeah, that means 7 Tesla is nice to have. It's very costly, using a lot of energy, but still it has not derived into the clinical pathway. So it's still, I would say, it's only a few indications for clinical at the moment. So
Yeah.
we only use for research purposes. On the other hand, some companies are coming up with 5 Tesla MRI scanners. But yeah, there are different field strengths. But of course, there is a huge difference between 1.5 and 3, between 7. So in 7, Tesla working means that those kind of regulations what we are used to use with 1.5 and 3 Tesla, like for example, implants, SR limits, or nerve stimulation, or some kind of metallic taste of patients, moving the patient with the table into the scanner in a accelerating way. This makes huge differences working at so. That's why I would say it's still possible, because we in the university hospital, we do every kind of MRI examinations remotely. fMRI, spectroscopy, stress heart examinations, whole body angiography, pediatric in anesthesia, pediatric with incubator. Yeah, every kind of MRI examination, what you can imagine, we do it remotely. Even mammography interventions, MRI, is done remotely. So the scan is done remotely. So to bring the bridge to the 7 Tesla, you can work remotely, but you have to have high skills of safety understanding, of MR physics behind these 7 Tesla scanners, and of course, education, training, and is mostly important. It is possible, but we don't do it in our hospital.
Just to complement the discussion, Anton, do you perform remote scanning on 3 Tesla scanners as well? Do you have them, or do you, it's just 1.5?
No, we have also 3 Tesla scanners. We have we have the PET MRI scanners, for example, the 3 Tesla scanner. We have Magnetum, VIDA, kind of different scanners. A huge number of scanners.
That's something I actually want to add on this, because we have this conversation today on LinkedIn as well, Anton, that CT is also being controlled remotely. It's not just, and Anton, you're saying like X-ray sometimes as well. Me and Julian actually went to this congress here in Portugal, and they had a vendor there. They were doing ultrasound remotely as well. So all the modalities are going towards the same vision. But again, in Brazil also, they were the pioneers of doing CT remotely, which is something quite usual for them. So it's not just MR, and we need to make that clear that we talk about MR because we are everything MRI, and that's our passion. But it's radiology. Radiology is going remote, and touching on that, how do you see remote helping remote areas? Sorry if my question is a bit
No.
confusing, but one of the big issues in healthcare around the world is the access to healthcare. So we live in countries that are very centralized. We have big cities. They have all kinds of scanners. As you're saying, you probably have 30 scanners between CTs and PETs and MRIs within your hospital, within that city. But if you travel a little bit more to the rural areas, how can remote operations help those areas to have access to these kind of scans? In your perspective, we spoke about this a little bit, but I want to hear from your perspective, which is always a little bit more futuristic.
Yeah. Before we talk about that, that's why I started my presentation with "we are all same." That means, first of all, we have to standardize our qualification as a radiographer. We might have different names, but we have to standardize. That means it doesn't matter if you are from Brazil, from Ghana, from India, or from Germany. Yeah, you have the same qualification. Sometimes the people in so-called third world country, I don't like this term. It is outdated and it's unfair because they have still high skill, high knowledge, more than, for example, even from radiographers from Germany, because in Germany it's not an academic profession. Anyhow, first of all, we should have to standardize our profession, our qualification to collaborate globally.
Do
That
you
would
think
that
do you think that's possible?
that's possible. We should have to work for that. Our professional bodies, international and European bodies, have to work for that. So that should be a
When
goal
when
from our.
when I ask if it's possible, anything is possible, right?
Yeah,
My question is more towards, is there an interest for that to happen, or there's a financial interest to make that not happen? If, for example, if I'm going to Germany as a Portuguese person, I need to get your certification in order for
yeah,
my degree to
yeah,
be approved there. There's money involved there. There's security, safety, all these kind of things behind that decision. If we raise all of those barriers, we allowing basically everyone from everywhere to scan anywhere, right? And
yeah,
that's the ideal world. That's kind of utopic vision, but I kind of see where you're coming from. We actually gonna record a podcast soon in June, me and Julian, with this huge organization around Europe that is kind of trying to do that within Europe. And I think it's a very interesting conversation that you bring to the table regarding that, because that's one of the biggest stones in our shoe in terms of remote operations. Because we can't go from one country to the other freely and scan from here to Brazil and from there to Italy because of this legislation thing. And at the end of the day, it doesn't make sense. We are one profession. MRI
that's right.
is a global
Yeah,
language, right?
definitely, definitely.
If it's a global language, why can't we all speak the same language, right? So I
Right.
fully understand where you're coming from, but I think we're still very far from that, unfortunately. But maybe with AI and with these agents, AI agents, and all the things that are coming into fruition in
Mm.
this couple of weeks and months, this might be something that we can achieve within the next couple of years. And
Yeah,
do you see that as something that can basically change the way we do everything, and maybe you could be scanning in Alaska or something like that?
yeah, definitely. This is my opinion too. We have the technology to bring care to patients all over the world. So we have the technology, and why should we not use it?
It's all
First
about
of all,
focus.
yeah, first of all, we are doing it even in Germany, for example, in rural areas. For example, where there is a hospital, there is an MRI, but there is no technologists at all, or there are technologists who are not able to perform a cardiac MRI exam. So we offer our services as a university hospital for this rural area. And if you just transform it to other countries or other continents, why can, for example, people who have the knowledge does not bring the knowledge to the other
But
colleagues?
how do you see us in general assessing that knowledge? And for example, Cassandra on the question, she's talking about medical liability. So we have liability, right? And what makes us liable for something is let's say in UK you have HCPC, that you are accountable for your actions against the HTPC standards. If you don't follow them, then you're liable for what you've done for your actions, and you can actually be
Yeah,
prosecuted. So how do you see us controlling that medical liability worldwide,
yeah,
and how do you see us assessing the knowledge that you're talking about? For example, if I get a radiographer coming from Italy or from Portugal to scan the United States, how can they attest their knowledge, that their skills in MR, and basically match the standards that they are expecting? How do you
mm,
see that?
yeah. I wanted to say 2 points, but I have forgotten the first one. I will go on with the second one. First of all, no, the first one is for your first question. How can we work, for example, Still, we are talking the same language, MRI language, but we are not able to perform the MRI examination due to regulation. So what I always say is it is, first of all, easy to look at the other professions. Yeah. For example, the radiologist. They are radiologists working in different countries, but reporting at the same image. If this is possible, why should it not be possible for radiographers? First. The second, even today, we have setting our education for new students completely different with remote scanning. That means today, a student is taught via multi-access. That means the student is performing the examination. I am live in this setting. I can take over the mouse and correct. I can advise him to do the examinations. So what I already told you, for us in our hospital, where I'm coming from, trained, we have no problems. We have always solutions, always. So keep it in mind. That means, let us say I have colleagues from my country, Sri Lanka, India, and there is one German MRI technologist in this multi-access tool at supervising these colleagues in terms of German regulations and are able to perform the examinations. And therefore, we can keep the liability at the same times while allowing other colleagues to do the examinations in Germany, because we are facing a lack of radiographers in Germany. Instead of closing the scanners, we should have to look for new solutions.
Can I just jump on this, Anton? Because I think what you said is so important, and I want to support it with another example, because I know in modern era we're always focus about liability, or someone is gonna suit me, which I do understand why, because it happens. But for instance, today I can share my experience. I've been asked to deliver like a small introduction to cardiac MRI to an hospital in Ukraine, and I did it with great pleasure because they didn't have any radiographer able to do cardiac MRI, neither a radiologist understanding cardiac MRI, but they need the service. They need urgently the service. And I was thinking while you were speaking, if we would have remote scanning, perhaps would it be a little bit easier for me to kind of like help them, like without all these barriers, you know. There could be like small contracts or even like volunteers. I'm sure there are a lot of people retired that would like to volunteer to help setting like a cardiac MRI service if there is a country that, you know, is facing like a war or something like that. So why not? Why not? We are always talking about liability, and I totally understand why. But there are situations that are even more concerning at the moment, you know. And if we break these barriers, you know, we can finally provide our skills to someone else in a
Yeah,
better and more, I would say, proactive way.
definitely.
I agree with you, Julian, 100%. I think, as Anton was saying as well, it's a decision between following the rules or saving someone's life, literally like that. But another thing that we're talking about, this legislation thing, there's already people doing surgeries from one country to the other with the Da Vinci robots and things like that. So I don't see how remote would be different for us, because surgery seems to me to be way more riskier and more liability involved than remote scanning. But anyways, that's something that we have to wait and see how it's going to develop in the next
Yeah.
months or weeks. There's a question actually from Isaac that I'm going to take now. I think it's a good point to take it. Is saying, Anton, do you have a specific MR safety curriculum in your university for radiographers to obtain prior to venturing into remote scanning? Is there something that you guys have?
We are working routinely with remotely. That means we have changed our training processes in total. First of all, how we train the radiographers on site with MR safety courses, and for example, in emergency cases, contrast media usage and things like that, we have changed the way how we train our radiographers. First of all, they have a dedicated training on site, how to position the patient, and with all this kind of safety matters, communication skills. And then the person who is trained then is moved to the hub, where the person can be trained from the specialist in the hub. The advantages is, in the past, a trainee in our hospitals were doing scanner hopping. That means he or she was moving from 1.5 to 3 to 7 to PET MRI to different software versions. Today, we are able to train the person in the hub with specialists. The person who is trained can choose the scanner what he want to be trained, choose the examination. Therefore, we have seen we could reduce the training time up to 50% if we train the person in the hub. Yeah? And of course, to answer the question, yes, we have really specific SOPs regarding remote scanning. We have divided responsibilities for on-site person and remote scannings, and we have written it down as a standard operation procedure with which each person, each staff can read at any time what to do when.
I think that's a very important point, because I think a lot of people forget the fact that we're not just changing the way we're scanning, we're changing the whole workflow. We're changing SOPs, policies, training, we're changing contingency plans, we're changing simulations. All of that will be completely different because we're using a different workflow. So it's really important that you mentioned that, because I think more people need to know it. Is there, I think it's also hard for most of us to understand, or for a lot of people to understand, that shift in the way we work, because we never actually see it happen. We never actually see a demo. We never actually see an example of an SOP that is changed to remote operations. And I know you worked on one before, you shared it with me, and it's awesome the way you guys wrote it down. Because, for example, the communication within your chat, because you talk to each other in a chat box, you also use coding. So you use kind of certain coding, so you save time as well, which is beneficial for the patient, which is beneficial for you. Do you want to talk a little bit about the communication between the local and the remote operator? How does that work for you guys?
Yeah, definitely. As I said, for example, we are all the same as radiographers worldwide, but there are tiny differences. For example, in protocols, in hardware settings, in different vendors of MRIs, tiny, really tiny differences. That means also it is not a one-fit-all solution. That's why I cannot share, for example, my SOP to another hospital, another country, because also the regulations, the laws, it differs from Germany to others. There are countries where, for example, only a licensed MRI radiographer can perform an MRI examinations. In Germany, it's not. So there are different differences. Anyhow, the key for safety is, for example, first of all, divided responsibilities, each for each group, on site and other side. Second, clear communication. Yeah, what we do, in our workflow, what we do is, for example, if I am at home, I even don't know who is the person on site. That means the remote technologist must trust the other person. That's really, really very hard for a radiographer, to trust the other person in terms of patient safety. That is the mind change what you have with remote scanning. So that means you have to trust, you have to rely on the other person. It's also for me really very difficult, but you should have to, because it's not your responsibility. So in our workflow, what we do is, for example, the person on site open the registration card with the patient and enter the body weight and body height. So therefore, I am 100% sure I know this is the next person, because the responsibility, which is the next person, belongs to the person on site, not to me. I know my understanding is now do this patient. All right. So therefore, who is be scanned is 100% sure. Second, we don't call each other. We chat, because you have the possibility in the remote scanning setting to talk via telephone, or you can speak with a conference speaker, or you can use, for example, chat. We in our hospital use chat because, as you may know, if you're working at the MRI department, the phone is the worst thing ever what you can have. Yeah, the phone is ringing all of the time. Everybody is asking, how is the weather? What is what is for lunch and something, asking everything, you know. You should have to organize it.
Can you fit a lumbar spine? Can you fit?
Yeah. Yeah, yeah. Yes, you know
Oh,
what happens. This is, yeah. And then so we said no phone call anymore. We just chat. So everybody who is involved in the scan, radiologist, patients on site, we have also somebody is called an organizer. He's also in this chat. Everybody's in the chat. So we can also do group chats, and we have developed our own chat language with shortcuts. For example,
That's what I was going aim. That's what I
yeah,
was aiming at. So let us know.
we have that means, for example, if I am starting the day, I need a password to enter the MRI scan. I just write PW, and the person on the other side knows 100% clear. All right, the person on the other side needs the password. Yeah. And S means stop and things like that. We have created our own language, and this is also in the SOP, and we are working with these shortcuts. We don't write sentences, yeah, and sometimes emojis, but it's only shortcuts to
Anton,
avoid misunderstanding. Yeah,
yeah, I think that kind of standardizes the communication, because if you have, for example, a new radiographer coming in,
yeah,
you will know exactly the code, and it
yeah,
makes it standardized. So that's the point that I was trying to make as well, because it's really important what you're mentioning, the way the communication has to be effective and clear. And if we're all different, we're all the same, we're all different, and you're coming from a different background than I do, than Julian does, that anyone here does, and I might say something in a different way on the text than you would do for the same situation. So we want to avoid ambiguity. We want to avoid this kind of bias within our cultures and languages. So using a standardized type of code will make these communications way easier. It's like coding. It's like using Python or something like that.
absolutely.
So
That's
it
very
makes
nice.
it makes it really easy to talk to your counterparts on the local area. I want to
yeah,
ask you one specific question that I've been it's in the back of my mind, because we're seeing this shift with the way we work with AI, with automation. How do you see automation and these AI agents and all of this new technology, LLMs, permeating the radiology world and changing the way we're doing things? Do you think remote will take some of these things into consideration? Will we use more AI with remote? Will we use AI agents and things like that with remote scanning to make it life easier? We saw a question about using goggles like AR and VR to scan
yeah,
patients.
yeah.
I talk about sometimes using holographic technology as well. How do you see this evolution with AI and remote scanning?
So this is a question where everybody starts to hate me.
I doubt.
Yeah,
Okay.
yeah. Anyhow, yeah.
You,
First of
you,
all,
you, you've been too nice so far. So it's
yeah.
about
So
time
thank
that
you,
someone
thank
starts.
you. Yeah. First of all, to all of you, if you look at industrialization, yeah. Before industrialization, everybody was building a car handmade. Every part was screwed handwise, all right? And industrialization made it with automation. That means not the specialists were almost required to put the tire in the car. It was somebody who never worked with the car. They said, only you have 4 screws, just do the 4 screws the whole day, right? And this did not meant that the quality was lower. The quality increased through industrialization, all right? That is the history, and that is still true. So if you transform this to remote scanning, if you automatize processes, first of all, quality will increase because you have standardized procedures. On the other hand, everybody will ask how to increase the efficiency. All right. You should first of all, we are facing 5 challenges in radiology: lack of radiographers, high demand of scans, sustainability, um, money pressure, and for example, the satisfaction of the radiographer. So we have five challenges. Yeah. And always the aim is how to deliver patient care efficiently. That means you should have to think about automatization. And when it comes to automatization, we know that there are technologies which can fully automatize the MRI scan.
So I'll tease you again. Sorry, I'll play the devil advocate.
Go for it.
Because when you talk about industrialization, basically that opened the window for automation, that opened the window for better quality, better cars, better construction lines, and all of that. But also opened the window for a lot of people that lost jobs, right? And those people struggled. And what I see nowadays with AI and remote is awesome for us to use remote, and I think it's not a risk in terms of jobs. But with AI on top of it, I think it becomes a risk. That idea that we're talking about of having one scan that does everything and having this automation and having the AI reading the raw data instead of the images that we're producing, that looks very, very good for the patient. That looks very good for the healthcare sector. But in the other side, in insight, basically for us radiographers, it looks like, what about us, right? Where are we gonna end up if we talk about AI in that perspective? I think
I would say
it's not a risk for that at all. But when we add AI on top of it, how do you see it?
I would say remote scanning and AI is a love marriage, not a settled marriage. Yeah. In my culture, I would say like that. All right. First of all, you have to think about the limitations. Where are the limitations with remote scanning today? Yeah. The limitations is the human being, is the radiographer. That means the radiographer is able to perform 2 scans at the same time. Routinely. You can do 3 with different options, all right? But routinely we do 2, and if you want to do 2 heart examination, it's impossible. So again, when we look at the other profession, the radiologist, yeah, how do they use AI? They still use AI as an assistant. So in terms of remote scanning now, if we could use AI as an assistant, where we are doing multiple scans at the same time, there is a second eye supervising you all the time, nicht tired, throughout 8 hours, looking for errors in your scan, checking the image quality. I would say this is, again, a huge opportunity for radiographers using AI, first of all, as an assistant. We will first of all talk about assistants. So that's my first vision. That's also my research area in my PhD. I would like to relieve radiographers in terms of reducing manual load to be creative. You know, it's in my hand to create the future for radiographers, not relying on companies or radiologists defining my profession. This was in the past, and I don't want to do it in the future. So that's why I also went in the direction of computer science, because I want to create my future of my profession. That's a political statement. Sorry for that, but
no, that's awesome. I think that's great.
yeah, first of all, I would say AI will be assistant, and in terms of remote scanning, multiple scans, it will be a huge helpful supervising us during the examinations.
Awesome. Perfect. I think it's a perfect answer.
Yeah, I think you summarized it perfectly.
I love the idea that you're working to make us more creative, because I think we need more of that.
Yeah,
We
definitely.
leaving creativity behind, and it's funny because when you're a kid, you always ask why this, why that, and you reach a certain point in your life that you forget to ask questions and you just do as you're told, and you're just trying to break that. You're trying to keep asking questions and keep being creative and building new things that are exciting things. So that's what I ask on my presentations as well, to open their minds and break those invisible barriers that we have, and try to be as creative as possible. So I really love that quote. I'm going to put it on the book for sure.
Guys, we are not button pushers, remember. We still can
Absolutely.
provide quite a lot of services.
Definitely,
So,
yeah.
Anton, we already like, it's 9:10 here, so I know there is 10:10. It's quite late for you. So we have a few questions on the chat. Julian, do you want to start with any of them?
Yeah, I'm not sure if we covered this already, but let's try again. So, Isaac is saying, can you, Anton, describe an event or a practical challenge that you faced while remote scanning and its workaround? So, was there like any moment that you thought, oh wow, remote scanning is literally giving me a headache here? And it would be better, to be on site and do things like old school now. For you, it's old school. For us, it's like new school. But yeah, well, is that a moment that define any situation as particularly challenging?
Definitely, definitely. There are a lot of challenges. For example, still today, the remote technologies cannot talk to the patient. Uh, there are techniques who can talk to the patients, but we in our hospital, we cannot hear the patient first. And the second, we are not recognizing the emergency ball if the patient brings the emergency ball for that. Those are two challenges still to be solved in my setting, in our
Sorry.
hospital.
Yeah. Okay. Sorry, Anton. I was going to
Yeah,
say that there's some platforms that allow for both already. So, but yeah,
yeah,
majority they don't.
naturally. And of course, when it comes to contrast enhanced MRI examinations, there is always a challenge. For
Mhm.
example, how to deal with contrast media in terms of MR angiographies, dynamic scans, and things like that. Okay, and another challenge is, for example, if you have, I would say, a little bit older scanners where automatic voice commands are not possible and things like that, you have to then do your workarounds. We have also these old scanners, we have our workarounds, but these were, first of all, challenging for us to perform this kind of examination in all of our scanners here.
Thank you so much. Thank you for being honest and transparent, because I think this is the only way of learning. I can see there are a few places here in the UK as well that are implementing this technology and they are
Yeah,
asking questions as well. So that
yeah.
is the best way to understand from the other. For someone that, for how many years have you been doing remote scanning now, Anton?
Until 2016.
2016, imagine.
Yeah,
The
yeah,
number of like inputs you have collected in almost 10 years. So it's quite interesting.
yeah.
Any other questions, Sam, that you think would be quite interesting to ask? There are quite a few in the chat, actually. They have
Yeah,
been
I think
sort of,
Stefan was asking if you can, Stefan, so if you can share your eventually um, the chat language that you standardize for possible blueprint for remote scanning programs. Is that something that you guys are open to share eventually in the future?
Definitely. That's nothing,
Share it with
nothing.
me, so I know about it already, but I think
Yeah,
it's
yeah,
a
yeah.
secret,
It
right?
doesn't matter. I think I know Stefan, and I will talk to him. I will meet him.
Perfect.
He
There's
can.
another
I think
one.
Stefan, you can write to me a private message, and I will send it to you. There's no nothing to hide. It's a self-developed chat language. So
There's a, can you
Amazing, thank you.
welcome.
It says here, can you advise around the most advanced platform available today, Jacob? To be honest, can I answer, Anton, or do you want to answer that?
Go for it. I have no answer for that.
Yeah, so Jacob, most of the platforms basically work the same way. So we have different platforms that are independent. There are platforms that belong to the OEMs, which is Siemens, Philips, GEs, and other companies like that. But most of them are multi-vendor, so they can be used in different scanners. So for example, if I have a GE scanner, I can use one platform and use the same platform to scan on a Philips, on a Siemens, or something else. So they all of them do basically the same thing. The setup is slightly different, but at the end of the day, they do the same thing. They're all based cloud-based or VPN-based. They have cameras, so you can watch the remote area, not the remote area, the control area of the scan. They allow you to speak to the local with video conference or by phone or by chat. So most of them have these functionalities, and we are working in different platforms to make it better and better, to allow for the buzzer when the patient presses the buzzer, so we as remote operations can see it and can actually action it and speak to the patient. So there's a lot of things that we've been developing with these platforms, but most of them are equipable. So there's nothing that we could say this is the best platform out there, and basically is better than anyone else. So they're more or less all at the same level as far as I'm aware.
Perfect.
Yeah.
I can see there is
Gemma.
another question also from Gemma. Actually, she said it's a basic question, but it's quite a question that has been asked quite a lot of times. So I think it's always good to kind of like reinforce what is going to happen with remote scanning and what we know at present, because we don't have the entire knowledge. Things are changing. I think you, Sam, but you, Anton, as well, can answer this. So she says, this is my first remote scanning webinar. Is the on-site person also a radiographer, or can this be a skilled healthcare professional, like an assistant training cannulation course positioning? And here comes the thing, Anton.
Yeah. First of all, Jim, I'm really honored that you are in this webinar. So we work together in some academic researchers. So really happy to have you here. And I'm really also happy you are interested in remote scanning. Yes. I can only talk about Germany. Yeah, in Germany, we in our setting, we have, I would say, trained, skilled medical assistants. What the the Americans call tech aides. It's the same. So we have, but we also have medical students work as a patient manager. They love to work as a patient manager because they are learning while they are working in MRI a lot. So this is for them a huge opportunity. Yeah, first of all, to have these persons on site, I would say this is really valuable because they are doing a tremendous job. It's an important job. Patient safety depends on them. That's why it's important, first of all, to educate them very well, to train them very well, and then the persons are really, really helpful. First of all, due to the lack of radiographers in Germany.
I will just add, Anton, you answered beautifully, but I'll just add that every country does it different, and some countries allow, for example, nurses to do it. Some countries having a nurse would be out of the question, like Portugal. Some countries use other technicians or technologies, I'm sorry, from, for example, CT or X-ray. They cross-train them. I didn't know about students. I think that's an awesome way of teaching students about MRI as well. Of course, it implicates they are shadowing someone else and not doing that as their own job. Because when you're a student, you should be a third person or a second person shadowing someone, learning what they're doing. But I think that's an awesome approach as well. I talk about a lot about the lack of training at university level, and that's a way of fixing it as well. When you bring these students to the front lines and teach them how it works on the front line, so that's awesome. We'll do this last question, and then I want to share a QR code with you guys about something that I've been forgetting to share. to share. So, if there were a single professional regulatory body for Europe or globally, would it make it easier for companies to hire employees at lower salary rates? This is Manuel. Is a friend of Everything MRI as well. So the question is basically if we can make this work in terms of regulatory compliance, would that mean that the prices will drop? Or when I say the prices, is the salaries of the radiographers? For example, if I'm working from here to US, I would get paid less because I'm coming from another country. I think that's what Manuel is saying. If
Yeah,
Manuel
I also want to add something on this, Sam, because I think as you translate the question is perfect. I think what also Manuel is asking is like myself as a company running a hospital, it might be easier for me, I don't know, to hire people like from like third developing countries because I don't want to kind of like pay the standard salary someone living, I don't know, in the UK, in Italy. So will this be a problem in the long term if it comes under like the same umbrella?
It's a very good question. It's a very good question. I always advise, for example, in Germany, the radiographers, first of all, learn MRI, specialize yourself, apply for remote jobs, but negotiate your salary very, very well. That depends to you. Yeah, how you negotiate your salary. And it's also depends on us radiographers to keep our quality, which is required in the healthcare system, very high. This is our job. So we should have to bring us together. We should have to build bridges. We should have to build communities like here to be strong together to fight for our, I would say, the word does not comes, but
Our profession, for ourselves,
yeah,
right?
for our profession, for ourselves, yeah.
Sovereignty, right?
Yeah.
It's all about self-empowerment, I would say.
But to answer the question, it is a marketplace at the end of the day. It is an economic forum. It is a platform. It is an international platform. That means at the end of the day, the quality will always win. But healthcare is an economic business too.
I would go even further, and probably people will not like what I'm going to say, but if you want to get paid more, be better.
Yeah.
Something like that. So I'm just going to share what I wanted to share. Let me just see what it is, because we have a group where we share basically knowledge about remote operations, documents, news, so all kinds of things, we share it there. So if you are interested, you just need to share this code, scan this code basically. And it's a LinkedIn group that I created about remote operations. We have around 1,000, almost 800 people there from across the globe. If you join us, we normally basically posting webinars, we're posting documents. I remember I just posted last week the Brazilian guidelines for remote operations. Of course, it's in Brazilian, in Portuguese from Brazil, but you can download it, put it on ChatGPT, and there you go. You have your guidelines, an example of some guidelines. I intend to share some SOPs there and things like that. Maybe eventually I'm trying to get a live demo, so something like this, and showing you exactly how it is when we're doing a remote operation while we're doing it. I think that would be super cool. Maybe, Anton, maybe we can do that. So it's really interesting, that kind of group, because we wanted to foster knowledge, and we want people to understand what we're doing more and more, and in more clear way. I'm going to share another one. And while we do that, I want to thank you, Anton, for being here, for being the person that you are, and for inspiring so many of us to do all of this that we're doing as radiographers, and as MRI radiographers at the end of the day. Because your story, as people said on the comments, is inspiring for sure, and make us want to do more, at least for me. It's been a pleasure to meet you. It's been a pleasure to share these conversations with you. So thank you so much for taking the time to be here so late in Germany. And yeah, this is the next webinar. If you guys want to join us, please do. And I'll give you some last words for Anton and Julian, of course, before we leave.
I want to leave the stage to Anton, so I will say just a very quick thing. Anton, I want to thank you, and the message that I'm gonna take for myself to improve today as a professional is something you said. You said that in your department all the ideas are valuable, and this is something doesn't really happen that often when you work in healthcare. You face a lot of barriers. You face people saying, oh, we always done this way. We don't want to change our workflow. And this is how we should think, to be honest. All the ideas are valuable. It might sound crazy. Remote scanning might sound crazy. Remote scanning might ruin our life, but all the ideas are valuable, and we should listen to what the people are kind of like trying to share with us. So that is just a little reflection on what you said, and thank you so much for everything.
Anton, do you have any final words for our community as well?
Yeah, I would say thank you very much for the opportunity. I would still say we as radiographers have a very, very nice and beautiful profession. We have a long history, more than 100 years, and we will even exist in the next 100 years. But the key is lifelong learning and creativity. Thank you.
That's amazing. Thank you so much. Guys, next episode, we go back to United States. We're going to talk with Derek. He's one of a kind person, super, super kind person, and he knows literally all the modalities. So if we have, not modalities, the platforms. So if you have any questions about platforms, how they work, the functionalities and how to use them, Derek is the guy. He's also the guy that can help you in terms of finding jobs in the United States and things like that. And we go through a little bit of zone 3, zone 4 kind of safety. So join us. It's not next week. So next week we have a break, I believe, isn't it, Julian? We have a
I think
break
we
next
have a
week.
break. I think we have a well-deserved break. No, I don't want to say too loud.
Exactly. So everyone can relax a little bit from remote operations, and we'll see you the week after. So next week there's no webinar. The week after, we'll see you all here again for a discussion with Derek Richel. So thank you so much, Julian. Thank you so much for your support as
Thank you so
usual.
much, Sam.
You've
Thank you
been
so much for
amazing.
putting this together again. Thank you, everyone, for
See you
attending.
in 2 weeks.
See you in 2 weeks. Bye-bye.
Bye bye.